Hello, everyone, and welcome to a brand new episode of Say Again with me, Amrita Tripathi. This week, it's going to be just me, and it's going to be a slightly shorter episode as I'm going to share a little bit about mental health and the conversations we've been having around mental health and mental illness here in India. As always, if you enjoy this podcast, you can go ahead and hit subscribe, give us a review wherever you're listening to the podcast. And if you want to support us, we'll have more information by the end of the show on how you can do just that. So Women's Day has just come and gone like every year. But for many of us, the issues that come up remain pertinent and something that we focus on really year long. So today I thought I would share a little bit from two of the talks that I was invited to give. I was part of two panel discussions over Women's Day. One was for the Times of India, where we were talking about preventive health. And I spoke about mental health from the context that I'm going to share with you right now, based on my work as a journalist, as a writer, and as a founder editor of the Health Collective, a platform that I set up almost 10 years ago this year to talk about mental health and mental illness from an India lens. You might have heard me speaking about the Health Collective in the past. In fact, we have a whole separate YouTube channel and lots of resources, some of which we link to in the show notes here as well. The second panel I was invited to was at Jindal University, and I was on a panel of stalwarts really talking about different aspects of public health and policy. I was speaking again from the point of view of mental health. And when we talk about the media, when we talk about digital, what some of us might want to know. So going forward, I'm just going to share some of the facts and stats and also some of the anecdotes that I've picked up over the last 10 years, especially even though I was reporting before that as well with the national news channel. I want to start by sharing some of the numbers that, might be surprising if you've not been in this field. And in fact, this episode is meant for those of you who may not be from the mental health community as such. Let's talk numbers. The landmark National Mental Health Survey that was commissioned by the government of India a few years ago, back in 2016, in fact, showed that 1 in 10 adult Indians at any given point in time will have a mental disorder. 1 in 10 Indians. That's a pretty big number. And I think it's also important to note this because, sometimes every so often you'll hear from someone something like they don't think mental health or mental illness or mental disorders are an India problem. Unfortunately, this is one of those issues that cuts across every divide you can think of. Mental health and mental illness don't know any geographies or national boundaries or even statewide boundaries. I think many of us know that it impacts all of us. In fact, all of us in our families or in our peer groups or in our friend circles will actually inevitably end up knowing someone who is directly impacted when it comes to mental disorders. So that number was 1 in 10. There was an estimate in 2017 that 197 million people in India had mental disorders. This could include depression, anxiety, bipolar disorder, schizophrenia, to name some conditions. I often actually reference an interview I did several years ago with leading psychiatrist Dr. Vikram Patel to put things further in context. He was talking about that number, and he went on to say that doesn't necessarily mean that the other 90% of us are enjoying good mental health. You may not have a mental disorder, and yet you could still have poor mental health. So one thing he made it clear, and I think it's helpful to think about, is that each of us, me, you watching this, your friends, your relatives, each of us has mental health. So usually what ends up happening is that there's somewhere on that spectrum, you're having good days, you're having bad days, you might be depressed some days, you might be anxious some days, you may not have a diagnosis and a disorder, but you may not necessarily be doing that well or having the best mental health. And his point was to start looking at how do you promote and prevent and protect really your own mental health. And that's something each of us can learn to do. You can watch that interview or read the transcript of that interview on our website. Many, many fascinating things came out of that interview. And I think it's helpful to frame. So 1 in 10 of us, according to that estimate, has a mental disorder. Does not mean the other 90% or other 9 in 10 are doing that great either. There are huge challenges, of course, in a country, in a region like ours, not least of which is the treatment gap. Some of you will have heard of this in the past, of course, that there are very few trained mental health professionals for a population of our side. Going further, you will also find that many of them are actually concentrated in the urban areas. There's a huge divide that has to be bridged in any case. So there's a treatment gap. There are also the barriers like access to care, affordability. There are barriers when it comes to stigma and seeking help. And I think those are things that some of us can help to work on. Now, we'll talk about women for a minute, though I was making it clear in both these talks, I'm not really a fan of pitting the genders against each other in general or in this area when it comes to mental health, because in a country like ours, in a region like South Asia, men and women are both suffering when it comes to not just the conditions themselves, but the stigma, the shame, internalized shame, the lack of access to quality treatment, and of course, the list goes on. But if we speak about women for a moment, there was an article I'd done a while ago, which I'll also link here, and I'd spoken to clinical psychologist Kamna Chibber and senior psychiatrist Dr. Achal Bhagat for some of the insight into this. Mental health disorders, in fact, like anxiety and depression, we know tend to show up more in women. Kamna Chibber saying statistically women tend to have higher rates of depression, anxiety disorders, body dysmorphic disorder, and eating disorders. They're also affected by mental health concerns such as postpartum depression and premenstrual dysphoric disorder. And I think, it'd be helpful for you to think about layering onto that the lives and the conditions and the social determinants and the intersections we know that exist. And one of these is that we know that the majority of the burden of invisible labor is done by women. Keep that in mind. The majority of caregiving responsibilities, whether it's for aging parents, relatives, or children, is done by women. So keep that in mind, because there have been links, of course, to exhaustion, stress, and burnout. But I would say I did not know this before looking up the research for this, that caregiving has all the features of a chronic stress experience, according to an article that I'm going to link in there. So lots of different factors playing a role. And that might be surprising to some of you who think of mental illness more from the lens of chemical, biomedical, etc. So you will be hearing a lot of people using the phrase biopsychosocial to talk about mental health. And I think this is kind of what they're getting at. It's not just one thing. It's not just chemicals in your brain. There are a whole gamut of experiences, social determinants, and other conditions that come to play. Now, as I said, I'm not a fan of pitting the genders against each other. And I have seen that, we have heard, in fact, that often women, despite that slightly depressing picture we just painted, often women will be the ones who do reach out for help, who will reach out to talk to people, even in their own support systems. Men, unfortunately, there are many, many reasons, for many reasons, I think that include structural infrastructure, stereotypes, bias, patriarchy. You'll be surprised to know how many men are also victims of those kind of things, don't always have those kind of enabling environments to reach out for help or reach out to talk. I sometimes reference the work of Arjun, a Knight of Steel on Instagram, who's a psychologist himself with lived experience, because he's doing such incredible work and informing so many of us of some of these challenges when it comes to men's mental health. So again, even though there's a Women's Day panel, for both of these, I actually wanted to make that point that it's not helpful to pit the genders against each other. I'll just share a few more things. Dr. Bhagat, in that piece that I'm going to reference, had shared that you have adverse life experiences often for women as well, which includes abuse, violence, discrimination, which can contribute to post-traumatic stress disorder, depressive disorder, and even personality changes. Going on to say also, and this is something I think many of us, it will track with many of us, women facing a lack of access to decision-making regarding mental health services and seeking help in that way. So when you look at mental health in that sense, and you look at it, it's actually something that touches every aspect of our lives. It's even more important and more incumbent on us to realize how critical it can be and how many things we can actually do to help, to promote, and to protect our own mental health and the mental health of those around us. I hope some of that is a little bit helpful for you. And I will say, I went on to talk about sort of digital and media, and I'll share more information with those of you who are interested in that. But when it comes to you and me and each of us, and it's not about being on a podium or having an audience or talking on a panel, there are things that each one of us can do. For those of you who just want to show up, I think each of us can learn to be kinder, not judgmental, not contribute to stigma ourselves. Because just remember, stigma is not something that just lives out there. It's something that, each one of us can contribute to or help dismantle. We can go a step further and learn to educate ourselves on common conditions of mental health or symptoms. There are, short mental health first aid, mini courses that you can do. There are ways to learn how to be a better listener, an empathetic listener who's not a judgmental listener. And many of us have done those, have realized actually often we do need a little bit of training in how to be better at listening empathetically. We can even go a step further and start looking for resources to help those we care about, because oftentimes they might be relying on us to show up, to learn more, to, lend a helping hand, help set up an appointment if need be. Remember, there are science-based, evidence-based systems of support. And even though I know I keep hearing about how it can feel that, talk therapy is very expensive, medication can be expensive, diagnosis is expensive, it's actually really important for us to focus on how we can get help to those who need it. So the step I think each of us can take can be to learn to be more informed, learn to find out where help is available, and learn to look out for each other. I hope that is helpful, informative, and not preachy. It's something I really do feel strongly about. So I'm happy to field any questions that I can take as somebody who's been working as a chronicler, as it was called, as a former journalist and as a writer in this space. We also, of course, have several books that were commissioned by Simon & Schuster India, which you can find links to in the show notes. And I hope that those also reach more people. We can learn to make these conversations less stressful and I think more accessible for everyone. And that's the note I'm going to end on for this week's episode of Say Again. Thank you so much for listening or watching if you have been. And I look forward to seeing you next week with a new episode and a new guest in conversation.